I came right out of undergraduate school in June of 1966 and had been looking at various graduate programs. Had applied to several, and I think I'd applied to Duke and interviewed with Ray Brown. What a privilege that was in January of '66. Interviewed with Fred Gibbs, and right after that here for the program. Really liked Washington, D.C., like we had to offer, and I had a young woman who was going to be at American University here, so one might say I was chasing a skirt to get to Washington, D.C. The benefit of being in a district was manyfold. We had access to policymakers in the program. We had visiting lecturers from various government agencies who were here on a weekly basis with us. We had a full-time core faculty that was spectacular. So all those pieces put together, we had an opportunity to see the best of an academic program, which was in the School of Business and Government, and we had a chance to then see many of the policymakers and other deciders here in the Washington, D.C. area. My preceptors turned out to be a very good mentor for me as well. Tom Hollis became a great friend. I really regretted leaving him in 1971 to go to work at the county hospital, or from the county hospital at St. Joseph's. We stayed good friends after that. Tom had some tremendous health problems shortly after I left. I would visit him periodically at the house, and we got back to work. And when he passed away, I believe it was in 1972, I felt a real loss because we had a very close friendship that was there. A lot of his bad habits I picked up over time, and that's a tribute to the great man that he was. The value of the residency program. What a gift that was to us in those early years. It was a chance to kind of bridge the academic with the real world. We had a lot of fun doing it. The residency was not scripted for us, not sculpted for us, but we had very few choices. The university in those days had relationships with various preceptors, and Leon and Fred and the other faculty would try to match us up with someone they felt would be good for us as students, things we need to learn, how we needed to round out our approach. So we were blessed to have had that sort of support. I know it's very different now. But the residency was a great learning experience. You could go in, you could get away with asking stupid questions and giving stupid answers that you would give to questions you'd be asked, because people didn't expect a whole lot of a resident. Tom Hollis, my preceptor, put me in with the residents and interns on the first day I got to the program at Maricopa County General in Phoenix in 1968. And I knew what they did, but they had no idea what I did. So I had the privilege of staying up night, catching babies, seeing surgeries, working in emergency rooms side by side with the residents and the fellows in that academic environment. So it was spectacular. There are residents today that I learned with back in '68 and '69, '70, that we're still good friends today. And it's been a privilege to know them and work with them. But had Tom not had the wisdom to kind of use the residency as effectively as he did, those relationships wouldn't be what they are 40+ years later. It was a special gift. We are, in those days, part of the School of Business and Government. So we have Masters of Business Administration degrees with a major in Healthcare Administration. So we had access to the best GW faculty members from the School of Business, as well as our own really great faculty. So we had the best of both worlds, so that helped quite a bit. I don't think there was one single course that stands out in my mind other than Fred's case study class, which was a real barn burner. If you went in unprepared for that class, you were dead meat. And once you did that, you never went back. And if you saw somebody else get beat up, you didn't want to get that case yourself. See, that taught us the value of being prepared. That taught us the value of having done your homework well in advance. When we had to write a paper for one of Fred's classes, we'd argue for weeks over the scope, 30 words or less. And once the scope was approved, the paper was essentially written because you talked about it with him, you'd worked through it in your own mind, you'd written this out 100 times, and you really had a good product which you'd be very proud of, and generally was at least A-level work, and sometimes even better than that. So it gave us great pride to see that. So it was the recognition that came from the accomplishments of the program as well. But I think we had just a tremendous faculty here on the campus at the time, and I know my exposure to the faculty today got equally as good, and if not better faculty people today than we had back in the 60s. But when they made the decision in the mid-90s to move from the School of Business and Government over to the School of Public Health and Health Services, that was a major change. And I know there's lots of angst amongst faculty, amongst students and others. I was president of the Alumni Association when we did that. And I really felt it was appropriate for now to bring together the clinical as well as the business education experiences. and I think for the most part it's been a fairly good transition. I know not without bumps and not without second thoughts, but the students that I see coming from the program today are as well prepared as other students from other programs across the country that I happen to come in contact with in my workaday world as well as in my academic advising world right now. The characteristics that one would need to exhibit today are not that different than when we started 40 plus years ago. I think it's a desire to serve people. You've got to truly want to be a servant leader. Not everybody is cut out for that particular mode of leadership. You've got to want to be a leader, and there are people that don't want to be leaders, that just want to be managers and make decisions based on a framework. One of the strengths of the program that we had, and I know it's still today, is we're helped to deal with a lot of ambiguity. We're helped to deal with indecisiveness in organizations and ability to move because of policy issues that are pending, of other activities that are always somewhere in the queue. It's not quite a complete picture. So you have to be able to make decisions on the best information that you have available to you at the time and go ahead and get it done and move and make it happen. And that's been one of the earmarks of this particular program. And it helped us through the process. Both the faculty advising us as well as the preceptors in the residency program dwelled on that effort quite a bit. So I think if we think back, you have to be prepared to deal with a lot of ambiguity. You've got to have a lot of tenacity. You've got to hold the line on issues. People always want to find the easier way around something, and you've got to have a strong ethical core yourself that you're not going to cheat, you're not going to do things that are improper, or that someone could come back there and say, why the dickens did you do that? I see a number of cases of that still happening today in the field. It's sad to see that. But I think GW gave us the firm rooting in the ethical and the value statements, as does the American College of Healthcare Executives, that we have to focus clearly on the ethics of ourselves and our organizations to drive that. So good, strong, firm footing here. You've got to have that personal footing yourself. It's easy to go astray. It's all too easy. I think also you've got to have a focus on today looking at diversity. All too often it's a single view world, whether it's male, female, whether it's African American, Hispanic, Latino, Asian American. There are people with great gifts that we have to reach out and engage in. We can't just sit back and wait for them to come to us. We've got to go to them. And that would be one of the strong points of this program that we learned way back when. Remember, Dr. Ginsick said one time to us, the only women we're going to have are going to be the nuns who need to get their education here. Well, I remember a discussion I had with some nuns later on where women first and nuns second. So, Leon, yours now to come back at some point in time. But the key is the tenacity, is the forthrightness. But you also got to have a vision. You've got to be able to see a future that's very cloudy, and you've got to be able to grab the horns and do with that. You've got to be able to work with people you don't necessarily always like. You've got to be able to help them see a different outcome. There's a new concept now called polarity management, where both poles are right. How is it that you can keep moving those two poles closer together to eliminate the areas of disagreement and concentrate on what's right? That's what we have to do as leaders. Physicians, a story was told years ago about a physician who met an administrative intern one time and said, what do you do? And the intern told him what he did. He said, oh, you're a mouse and trained to be a rat. So there's lots of folks that looked at us in very different ways, as managers, as leaders, as blockers. Excuse me, the physicians want to get things done. We've got to be able to provide that servant leadership, which is understanding all the issues, being clear in our focus. Sometimes organizations don't want to have that done. We've got to be able to reach across that table and make sure we've got the best information from the best people we can possibly get. Leading an organization is a team sport. It's not a single sport. And while you may be the president and CEO, you've got to bring your team along. You've got to get good people. They've got to get good people. Physicians are there to help us, and they've done a tremendous job so far. They view things differently. They're scientists, and yet when you can work with them very effectively, efficiently, and help them get their job done better, they're one of your most stalwart supporters at that point in time. And that's what makes it all fun. Bring all those disparate focus points together, and you can make all sorts of magic happen. What do I want to be remembered for? I want to be remembered as a good leader. Somebody brought people together, whether it was around the Gibbs campaign back in the late 80s, early 90s, whether it was around the Coral campaign, which we just finished up, whether it was the Alumni Association. I just want to be remembered as having worked with people, brought the folks together. I've had a lot of fun doing this over the years. I told the students earlier today in a program we did, the 42 years of work, I would probably want to change 2 or 3 minutes of it. That's all. That's not a whole lot when you look at it. I've had a lot of fun. Sometimes you have to work at having more fun than, or have to do more work at having fun than you think you should do, but nonetheless, the more you put into something, the more you get out of it. And if you want to be a coaster, healthcare leadership is not the role to be a coaster. If you want to ride along on somebody else's coattails, this is not the field in which to ride along on somebody else's coattails. You've got to be out there. Leadership is a contact sport. It's a great sport. It's a great opportunity. So to be a servant leader is a great way to be remembered. That's how I like to be remembered.